but glaucoma is not just my that reading. I got a high reading on that. Glaucoma, you can actually have, you can not have glaucoma with high pressures, and you can have glaucoma with low pressures. What glaucoma is actually a disease of the optic nerve fiber. You actually lose optic nerve fiber, and you say, well, why? What does that do for me? Well, the optic nerve fiber layer is what carries the information from your eye to your brain. So if you lose that, you lose your vision. And the thing with glaucoma is it's very treatable, but it's also a disease that doesn't hurt, and you don't know you actually have it. The only way you can really find out that you have glaucoma is to get a good eye exam.
Okay. Eventually you would know, though. Eventually you would.
If it was really terrible glaucoma, you would lose most of your. I mean, you would become completely blind.
Right. So I'm assuming, I don't want to put words in your mouth, but one of the reasons here to get this.
So that doesn't happen.
So that doesn't happen, right?
Right.
And so what do you do? How do you deal with it? And you guys can deal with the glaucoma, right?
Correct. I mean, the simplest thing with glaucoma is a drop. And what does that eye drop do? It actually lowers your eye pressure. So
something that simple.
Very simple. It's you come in, and there's different diagnostic tests that have to be run. It's not just your pressure is a little high. I think we'll treat you for glaucoma. That's not how it works. And glaucoma is not a disease that you'd have one day and you don't have the next. It's it's a continual process over time. So what you want to do is when you come for a glaucoma exam, the key is the doctor being skilled enough to look at that optic nerve to make sure that looks healthy. Okay. And the only way you can do that is through a dilated eye exam.
All right. Now there's another question for you. These are the terms and the cataracts. And can you explain the cataract? And I know somebody that was born with a cataract years ago.
Sure.
And they never got it fixed. I don't even know if you could get it fixed, 40 years ago.
Well,
when you were born.
You could, but it was not when you're born. And what you're describing there is what's called a congenital cataract, one that you're born with. And if I could try to describe what a cataract is.
Yes.
In your eye, behind your pupil, is what's called your lens. It's what does our focusing. And all a cataract is an opacity in that lens, or that lens is not clear. Once you see a lens that's not perfectly clear, or there's an opacity in it, that person has a cataract.
Okay.
And not just the 95-year-old neighbor that you have gets cataracts. Everybody gets cataracts, but
really?
there's a difference between having significant cataracts and having cataracts. And what you'll notice, and what a significant cataract is when that opacity or not, your not clear lens is having an effect on your vision. And the person that best tell me that is the patient.
Now, how do you go about removing a cataract? And in my notes here, I see that Dr. Stephen Dudley does the cataract surgery. Could you tell us a bit about him and how he would go about taking care of that?
Sure. Once a cataract's diagnosed, it's well, I wouldn't say there's no surgery that's simple, but on a scale of things, cataract. If you think 20 years ago, oh, that was a big deal. A person's having cataract surgery. Now it's between a 5 and 10 minute procedure that Dr. Dudley does. You go into our surgery center, which we own in Oshkosh.
All right.
And so there's a lot less red tape than having to go in through a hospital. It's very easy to get in and get out. Most patients that have cataract surgery will go in. You do one eye at a time.
Okay.
And you're in and out in about 2 hours or less from our surgery suite. The next day, you're often seeing pretty well.
Wow.
And we're actually very, very lucky to have Dr. Dudley in this area. I've known Dr. Dudley now for over 10 years.
You were telling me off there that's why you do what you do right now in Fond du Lac.
Yeah,
right?
he's I look to him as kind of a father figure almost. I was told once that a surgeon is kind of similar to an athlete. I mean, you're dependent on your physical and mental abilities. And I mean, I could tell you, Dr. Dudley is about as good an athlete as you're going to find. He's the Tiger Woods of eye surgery. I mean,
who, by the way, had LASIK eye surgery.
Yeah, he did.
Yeah,
and I'm not just saying that he's the only surgeon I know. I've witnessed 50 to 100 different surgeons throughout my training, and my experience is he's as smooth and as painless as a surgery as you're going to experience.
Real quickly, and we may have to continue this at another time because I don't know if we're going to have enough time to get into everything I'd like to ask you here. But you mentioned the congenital, I think that's what it was.
Congenital cataract, one that you're born with.
Is that something that can be reversed later on if somebody sees well out of one eye but not another? If something were to happen to the good eye, could they reverse that?
No. Vision is something that's developed. And the key thing about, like, for young like parents out there, if a child is not seeing out of one eye, and he or she doesn't develop the vision in that eye, much past 8 years old, they're never going to be able to develop vision in that eye because vision all occurs in the brain. So if you're not stimulating that area of your brain, you can't learn how to do it when you're older.
Really?
So that's why it's important, to when you have young children, you should check to make sure that their eyes are working on equal levels.
Wow. We're talking with Dr. Mark Veth from OptiVision Eye Care here in Fond du Lac, and as well as Oshkosh, Appleton, Berlin, Neenah, and I guess two places in Oshkosh, huh?
Right.
LASIK is so big right now. So many people. In fact, Phil from Mom and Pa's just said that he wants to get a 4-for-1 deal, the whole family at once. But the LASIK surgery, we don't have a lot of time, but can you get into a little bit about that and maybe some overview on that?
Sure. LASIK is, I think it's actually the most widely performed surgery and the most successful surgery in the country. What it is it's a reshaping of the cornea. The cornea is, like for all your contact lens wearers out there, it's what you actually put the contact on. It's the clear lens over your pupil, over your iris there. And what LASIK does is it reshapes that, and basically all it's doing is it's doing what your glasses and your contacts do, but you're actually reshaping the cornea of your eye to do that.
Okay.
So it's a very quick procedure. That one takes less than it's probably about 3 minutes an eye it takes to do a LASIK procedure. It's painless again. All you're going to feel with LASIK is a little bit of pressure on the eye, but and your visual recovery is. You go home, you take a nap after the surgery. 4 or 5 hours later, you wake up, you see alarm clock, you watch TV that night, probably for the first time.
And this has really developed over the years, hasn't it? Hasn't it continued to get?
It's gotten continually better year after year after year after year, and a lot of that has to do with the the technology, and the laser is the we use a Veth Star laser. There's other lasers out there, but the Veth laser is the absolute best that's out there. It's the one that it was the first laser used in refractive surgery. I mean, it has the most money behind it,
and the best track record and everything else.
Right.
We're just about out of time, but can people get surgery here in town, or do they need to go to your surgery center?
We can do all the workups pre and the post-op here, but the actual surgery, we have 3 offices where we have a laser. One is in Milwaukee, which takes about 55 minutes to get to from here. One in Appleton, and everybody knows how far Appleton is in, and then one in Green Bay.
Dr. Mark Veth, we're out of time.
Well, thanks for having me.
How do people learn more?
1-800-20-HAPPY.
1-800-20-HAPPY.
Or 800-20-HAPPY.com.
800-20-HAPPY.com.
There you go.
Dr. Mark Veth from
pleasure.
OptiVision Eye Care. Let's do this again.
Sure.
And I think we could take some calls next time.
All right.
Thanks much. We'll be back. This is The Morning Show.
Filing your own taxes? I've got a question for you. Why go it alone? Why